This video will demonstrate the process for ordering and administering the oxytocin infusion to a labouring woman in the IEMR. Standing orders will require a medical officer to sign the order within 24 hours. Prior to ordering any medications, a current weight must be recorded in the IEMR. To order oxytocin, navigate to the order screen, click on the Add button and search for oxytocin. Then choose the order sentence that your facility uses for oxytocin in labour use. You will need to nominate the consultant for cosign. Sign the order, and once we've signed off the order, we can refresh our screen. Once we've refreshed our screen, we can then review the patient's chart for any allergies. And once we've reviewed the allergies, we can review the order in the MAR. To administer, we'll navigate to the More. In practice, you'll scan the patient's armband and the medication chart will open. However, for this demonstration, we have to select that the scanner is unavailable. Click into the checkbox for oxytocin and a mandatory field will be highlighted. When you click on this box, order details will then be required to be filled in for the commencement of the infusion. Once the order box appears, input the mandatory fields of site, rate and dose. When completing the oxytocin dose, if we input the measurement of millunits per minute, this will automatically populate the rate. Once the mandatory fields are completed, click OK to begin the infusion. And then we can sign the order. The next thing we'll be demonstrating as part of this video is how we alter the rate of the oxytocin infusion when required. To do so, we would navigate to the MAR and remember that every time we navigate back to the MAR or any screen in the patient's chart, we always refresh our screen to make sure we're pulling through the most recent data. On the administration window, we'll click on the task to open up the administration window. Click on Rate Change. You're required to click on the words rate change and not on 1 ml per hour. When the rate ml per hour is changed, the oxytocin dose automatically updates as per statewide guidelines. Click Apply and then check that the details are correct in the top part of the order box. If correct, you can then save the changes by clicking on the green tick. The screen will then go back to the MAR and you'll be able to see the rate change displayed there. Here we are demonstrating the rate change being entered in of 2 ml per hour, and we're going to sign this off. Now when we refresh our screen, we now see the rate change. Hourly documentation of the IV infusion device checks is to be done in the Adult Quick View under Hourly IV Infusion Device Checks band. You will be required to create a dynamic group and put in the IV medication name of oxytocin. Here we're demonstrating how to create a dynamic group. When we click OK, we will now see oxytocin is showing in the hourly IV infusion band. Now, every hour you can document on the site condition, device check and rate. Always remember to cease the oxytocin infusion when this is no longer required. The oxytocin infusion must be discontinued prior to the patient transferring to the postnatal ward. To cancel the order, we navigate to the order screen, we locate the order and we right-click and we select Cancel Discontinue from the drop-down menu. We must input the mandatory field, which is the discontinue reason, and once we've selected that, we can click on Orders for Signature and we can sign to cancel the order. And then remember to refresh. The oxytocin order will now no longer be able to be viewed on the orders page. This concludes our video demonstration for ordering and administering oxytocin in labour. Remember, always call for help if you're concerned, and please contact your educators if further information or support is required.